We continue with treatment principles. This time, how to tonify the upright qi. Tonifying the upright qi includes any method that strengthens the body condition and increases resistance to disease. This may be achieved with acupuncture, herbal treatment, exercise, diet, Gong, meditation, or often simply rest. More specifically, from the acupuncture point of view, it implies tonification of qi, blood, yin-yang essence, and original qi by the use of the reinforcing method of needling or moxibustion. The strategy of tonifying upright qi is applicable when this is weak, or more specifically in purely empty patterns, that is, when the upright qi is deficient and there are no pathogenic factors. This approach can also be used in mixed deficiency excess patterns, but only if the pattern is predominantly deficient. In such a case, tonifying upright qi strengthens qi so that it can eliminate any pathogenic factor that there might be. Hence the saying, support upright qi to eliminate pathogenic factors. It must be stressed, however, that this approach is applicable only if a mixed deficient excess pattern is predominantly deficient. If, on the contrary, there is a strong pathogenic factor, tonifying upright qi may not only fail to eliminate it, but actually, in certain cases, even reinforce it and make the condition worse. This is more likely to happen when herbal medicine rather than acupuncture is used. The approach of tonifying upright qi is applicable only in interior conditions, as exterior conditions are by definition of the excess type, being characterized by the presence of an exterior pathogenic factor. Only in very few cases of exterior conditions is it necessary to combine expelling pathogenic factor with tonifying upright qi. Examples of purely deficient patterns when the approach of tonifying upright qi is applicable are spleen qi deficiency, manifesting with lack of appetite, tiredness, loose stools, empty pulse, or blood deficiency, manifesting with dizziness, blurred vision, poor memory, scanty periods, choppy pulse, pale tongue. An example of a mixed deficiency excess pattern, but predominantly deficient, might be that of stomach and or spleen deficiency allowing themselves to be invaded by liver qi, manifesting with tiredness, no appetite, loose stools, an empty pulse, slight dull epigastric pain, and slight nausea. The last two symptoms are due to stagnant liver qi invading the stomach. In this case, however, it is not that liver qi invades the stomach, but rather that stomach qi is weak and allows itself to be invaded by liver qi. This is borne out by the prevalence of deficiency symptoms and signs. In this case, the correct course of action is to tonify the stomach so that when this is strengthened, liver qi will not be able to invade it. In mixed full empty conditions, in which the emptiness predominates and therefore tonification of the upright qi is called for, the pulse is an important factor in the determination of the correct treatment principle. In fact, the strength of the pulse is an important factor in deciding the relative importance of the deficiency or the excess. For example, in the example given, of deficient stomach and spleen being invaded by stagnant liver qi, an empty or weak pulse indicates that the deficiency predominates. If the pulse were wiry and full, it would indicate that the excess, that is, liver qi stagnation, predominates. So the strategy of tonifying upright qi is applicable when this is weak, or more specifically in purely empty patterns, that is, when the upright qi is deficient and there are no pathogenic factors. Thank you very much for your attention.